Okay, and the first picture that you're going to see on this video is a diagram of the breast, and it shows the different features of the breast. And this is important to you because when you go back from your biopsy, your doctor hopefully is going to explain to you what kind of breast cancer you have, where it's located, and what it refers to. So it's good to familiarize yourself with the anatomy of the breast. And so I put this diagram up for you to be able to look at. There are probably other websites you can go to find diagrams of the breast and better understand what kind of cancer you have in reference to that. You can spend some quality time researching what the doctor tells you at your appointment after your biopsy, and it will give you a greater understanding of the cancer that you have and how to best treat it. The next diagram that you're going to look at is the diagram of the deep flap, or some people call it the tummy flap surgery, and that is the surgery that I requested. And you'll see there exactly how that surgery is done. In this diagram, it only shows the removal of one breast, but I actually had the bilateral, which was both breasts. And you have an incision from one hip bone to the other hip bone, and they take out your abdominal tissue and they use it to create the flesh that you need for your new breast, as opposed to using an implant. And it does have a longer recovery time, and it does have some risk to it. There's a 3% likelihood that you will need another form of reconstruction. But every surgery does have its risk, and that is a question that you need to ask your doctors when you are talking about what kind of reconstruction, if you choose reconstruction, you're going to have. Some women don't choose to have reconstruction, and if it's not something that's important to you, I don't see any reason why you should have to have it if you don't want to. But if you do choose a reconstruction, you need to talk to your doctor about the type of reconstruction that you want to have, and you need to ask about the risks that are involved in it, what kind of limitations are involved in it, what's the success rate of the surgery, and what is the satisfaction rate of the surgery, because those are very important. And then you need to go home and research your plastic surgeon and find out how much experience they have and how many times they've done the surgery that you want to have, if they've involved in any lawsuits, how long have they worked at the hospital they're at, where were they before they came to that hospital. There's so many important questions. You need to really research that doctor and that surgery, find out everything that there is to know about it, and really research the other surgeries too that you're not going to have, and find out what there is to know about them, because in my experience I found out some things that I didn't know about some other surgeries that helped me to choose what I wanted to do. So these are just two diagrams that I have from the hospital that I went to at Vanderbilt that helped to have a better understanding of the breast cancer that I had and the surgery that I chose to have. I'm sure that you can go online and research reconstructive surgery or research the anatomy of breast cancer, and probably bring up other videos or diagrams to help you better understand. And I just want to re-emphasize that information is power. So try to inform yourself as extensively as you can so that when you go back to the doctor, you will have information. And make sure that when you go back for your checkup after your biopsy, that you record the conversations that you have with your doctors, and if it's at all possible, ask someone, at least one person, to go with you that can help you remember what was said and take notes and discuss the conversation after you leave. I can't emphasize enough how important your support group is going to be through all of this. And however you go about it, you need to begin as soon as you find out that you have surgery to form your support group, because these people are going to be very instrumental in helping you through not only the decision-making process, but the treatment and the recovery process. So please take your time and delve into these things and do it on purpose. I hope this helps you some. And next time when we do our next video, we will talk about what actually happened when I had surgery. Have a great day. Bye.